Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about 8 common causes of swollen ankles. Is a doctor visit needed?
Right, Bob. Swollen ankles are relatively common. Sometimes
Yeah.
can lead to something serious. Other times, not so much. But we're going to go through 8 different things. Listen up to them, and you'll figure it out. Maybe for you, maybe a family member, older friend or mother
I
or
just
father.
had a friend this weekend. He's turned 60. He joined the club, and he actually is complaining of that one leg swells up. And I'm like, you got to see the doctor.
Yeah,
Because
right.
he's diabetic. He's got a lot of things going on.
Yeah,
So
right, exactly. So should we start out right away,
Let's start
Bob?
off,
Now, the
yes.
first one, you and I and other men are really not that familiar with. It's pregnancy, but we know that, pregnant women, that is one of the problems that can occur is retention,
you
water
know what
retention.
I found about pregnancy?
Oh, my
This is true. There's
Okay.
a book, What to Expect When You're Expecting. Is a really well-received book.
So
And-
people, who are gonna be pregnant, or they
Or
they can.
pregnant, they can follow along at every stage.
Yep.
And you get everything. Yeah.
Yeah.
I mean, I'm seriously, everything
you
under the
read
sun.
it?
I read it.
Oh, good.
Yeah, I was there with my wife.
So what's the name of it again?
What to Expect When You're Expecting.
Oh.
I bet it's been out in publication probably for 30 years.
Sure.
Oh.
And I really think, typically there's a doctor involved when someone's pregnant.
Right.
So
you
yeah,
don't need to go in and say,
you should have a doctor involved if you're swelling ankles when you're pregnant. It's probably not a big problem, but it needs to be,
well, you want
addressed.
to make sure you're not going to get a blood clot or something like that.
Right.
So,
Some other thing.
Yeah.
The next thing, common, what is it? 80–90% of the people sprain their ankle throughout their lifetime. It's very high. And you are
I've done it.
Yeah, you're probably going to experience swelling with an ankle sprain. It's common. You don't need to see a doctor for it. Although you could, if you want to see if there's a fracture. There may be a hairline fracture, something like that.
If you're not able to take weight on it, that's starting to think that, you need to see a doctor.
That's a good time to see a doctor, get some x-rays. But other than that, you can, put some cold pack on it, elevate it.
You can wait a little bit to see if you need to see the doctor.
Exactly. My daughter sprained her ankle pretty bad in basketball. Her mother is a registered nurse. I'm a physical therapist. We did not go see the doctor because we knew even if it was broke, they were going to say, go home, ice it, wrap it, blah, blah, blah. We waited till the
Put
swelling.
it in a boot.
Yeah. Well, we waited till the swelling came down. She didn't actually need a boot. She went to crutches and
She was fine.
Yeah, it started. She was 16. They heal fast at
That's
that
right.
age.
That's true.
So, anyways, that's the trauma section. Number 3, lymphedema. Now, this swelling is completely different. You do not have to have any trauma. The leg or ankle starts to swell up. It has to do with the lymph return, which is fluid in your body. It's not part of your blood system, not your venous return, but it's fluid that's extracellular, and it comes back up through your lymph system, gets filtered through your lymph nodes in the femoral crease, and then back into your
Now,
system.
your lymph nodes could be blocked somehow,
Yes,
right?
right.
It could be a blockage
Yep.
in your groin.
Exactly.
Or behind your
Yep.
knee.
So you're getting this swelling without any trauma, and you're kind of wondering, like your friend, he's getting this swelling.
Right.
You should see a doctor then, find out what's going on.
You want to go at least the first time to make sure to rule out any problems.
It is typical with obesity. There's no real direct problem, but it's part of the whole being obese and with the body function with that. It's typical with cancer treatments. If you have a lymph node removed.
Yeah, remove the nodes help act as a filter.
Right,
for
exactly.
the lymphedema. And if you remove the nodes, it can get caught in that area.
Yeah, yeah.
So fluid.
It interrupts the flow. So obviously, those people are involved with a doctor and being treated. The next one, venous insufficiency. Now, that's where the blood coming back through the vein, the artery supplies the blood, then the vein comes back with the deoxygenated blood, and it's, doesn't have the everything it needs for the proteins and all those things.
Right. So the veins
So that's coming
are
back.
not working like they should.
Right.
They might be collapsing on you, or
Yep.
they're just not in good shape.
Right.
So
And if you're having swelling from that, that should be a doctor visit as well.
Right.
Boy, a lot of these things are requiring a doctor visit, Bob.
that's why sometimes you wear compression stockings
Yep.
to help aid the veins,
Ri-
the veins on the way
right,
back.
yep,
The venous, I was
yep.
going to say. The veins.
And again, a lot of these, it'll require a doctor visit, but then you're going to treat it on your own oftentimes.
right.
It may be a medication, maybe the compression wear and whatnot. Now, this one, if there's infection from trauma or a wound, if you get some redness, some swelling, the big, the line going up the leg, if you
Yeah.
have a wound, these are all big problems or potentially big
this
problems.
is time to see the doctor now.
Right.
Not wait.
You're not going to wait and
Yeah.
call and wait 2 weeks for when they have an
Right.
opening. You're going to go, to urgent care probably. But get in there and make sure it's not a problem.
Yeah, infection can get out of control,
Right.
and really wreak havoc on your system.
So again,
So-
it's redness. Things are getting warm.
Right.
That does not happen.
And the swelling along with it.
Right.
And
Yeah. That,
kind of-
that kind of stuff doesn't happen with
Right.
lymphedema or venous insufficiency.
Right.
There's something going on. Your body's talking to you, so you got to listen and get to the appropriate care.
DVT.
Yes, a deep vein thrombosis or blood clot. And in this situation, it's probably going to be in the calf, maybe behind the knee.
Right, behind the thigh
yep.
sometimes.
And with that, you'll get this the swelling in the ankle, and in the calf. If you grab and squeeze it, it's going to be tender, painful. There's something called a Holman sign, although it's not real accurate
Right.
to help determine if there's a DVT. To find out if there's a DVT, you have to go get a scan, a
Right.
Doppler's scan, and it'll confirm it.
This too can be life-threatening.
Yeah, it can. But again, you see it early, and it's easily treatable
And
with some
you-
medication.
Well, you probably wonder, why is it life-threatening? Because a clot can let loose.
Mhm.
It can find its way up into the lung and suddenly compromise your breathing.
Right. Yeah,
So
and then
people have died from these.
sure, or
Oh.
it could break loose and eventually get to the brain and cause a stroke.
Right, exactly.
Mhm.
So
Yeah.
not to mess with.
Yeah, and that's an easy one. You go in there, they'll check it out and find out pretty easily. The next, heart, liver, or kidney disease. These are the types of things that come on slowly. You don't have swelling, but over a period of months, you notice your legs start to swell up a little bit here and there. And it's typically both legs.
For example, if your heart is not pumping well,
Yeah,
the fluid it's not handling the fluid that's coming back to it.
right. And then
So-
it builds up. I know my
Right.
father had that, but and again, doctor visit.
Yeah.
They're going to deal with that as appropriate. Probably some.
So pretty much everything has to go into a doctor
Well,
visit. Well, maybe the ankle sprain you can hold off a bit, and if you're pregnant, you can hold off a bit.
Yeah,
but,
yeah.
but when you're pregnant, we always like to be cautious too.
Sure,
So-
exactly. Side effects from medications, the last one. Already you're seeing a doctor, and they should tell you, or the pharmacist will let you know. You may get some swelling in your ankles from this medication, and so it's something you're forewarned on typically.
And sometimes they put you on medication to help with the swelling.
Yeah, right.
So-
It may be a second medication
Right.
to offset the side effect of the first medication, which that scenario does happen.
Yep.
So, yeah.
That is the 8, Brad.
Yeah, 8 of them, and typically for an ankle sprain, ankle swelling, you don't need to see a doctor on a regular basis, but just to get the red flags, big problems out of the way.
Right. To make
Right.
sure that you're okay.
Absolutely.
So remember, Brad and I can fix just about anything.
What about a giveaway? It's a future.
video.
No.
We don't just go to bobandbrad.com, go to the giveaway section,
yeah.
and you'll find out what we're giving away. Or go to Facebook.
Yeah.
Join us on Facebook,
Yep.
and it'll be pinned to the top of the page. Every week, we give us something away.
And-
Nice stuff.
And what I'm going to say prior to this was, you said we can fix about anything,
Except for,
a broken heart.
right.
Right.
A
Yeah.
broken heart could cause increased fluid. crying.
Yeah.
You got a broken heart, you cry.
I don't think that's going anywhere.
All right. Thanks for watching.